Hello, everyone. Welcome to the 2020 West Michigan Wellness Symposium webinar series. I'm Jean Sarge-Bono. I'm the Executive Director for the American Heart Association in West Michigan. The AHA's highest priority is to keep our community safe and healthy, so we've worked to bring the annual West Michigan Wellness Symposium to you virtually through this online webinar series. What is the purpose of the West Michigan Wellness Symposium? Because work plays such a significant role in our lives, it's important to recognize its impact on health and overall well-being. The AHA has been working with many local company leaders in West Michigan to develop this wellness symposium as an informal place for HR professionals and company leaders to discuss the most current issues that are out there, creating a healthy workplace. The AHA is committed to forging ahead with events such as the Wellness Symposium because chronic disease and health disparities haven't stopped due to COVID-19. As a matter of fact, COVID-19 has increased the urgency around the dialogue of prevention and building healthier lives for all. We know that the focus on prevention and a culture of health and well-being in the workplace can really be a significant driver in helping to build a healthier, more equitable community for all. So we're very excited to present the Wellness Symposium series to you in this virtual format. I'd like to thank our presenting sponsor, Meijer, and our other sponsors, Feist Electric, Priority Health, and Terryberry for making this Wellness Symposium series possible. Today's session is session 3 and the last session in the West Michigan Wellness Symposium series. Today we're welcoming Dr. Lorissa MacAllister from Enviah and Jennifer Kirby from Steelcase. There are many studies that show our environment, our surroundings, the spaces, lighting, air quality, colors, even the organization of workflows and how employees interact can impact our physical health and mental health and well-being. So we're excited to have both of you here with us today to share how we can make our workspaces and workplaces healthier. Dr. MacAllister, and then followed by Jennifer, will you please introduce yourselves and tell us a little bit about what you do?
Great. Thank you, Jeannie. This is Dr. Lorissa MacAllister. So excited to be here today. And our work at Enviah is really helping organizations get the most out of both the people and the environment. My background is actually as an architect, and I've worked many years to study the role the environment plays in promoting healing and health. And looking forward to sharing some tidbits today that hopefully will help you to transform how you work every day and how you can better support your organization. Thank you.
I'm Jennifer Kirby. I'm a regional application consultant, and I support the Mid-Atlantic region for Steelcase. So I'm part of a networked global team of design professionals. Steelcase is unique in that we're kind of a research-heavy organization that leads to I don't know, some products that are way beyond or way before their time, which is kind of interesting. And so I connect those to great applications wherever work happens. And I don't know, it's kind of a unique job, but I've been doing it for a little over 8 years, and I've been in design for 20. So thanks for having me.
Wonderful. All right, Dr. MacAllister, I will have you kick off. Thank you so much for joining us today.
Thank you so much, and very excited to share the information today. As I mentioned, Enviah works with organizations to better align the built environment with their organizational culture, really creating a transformation throughout the system. And so today we're excited to share more about how the building can really be a tool to help support your organization to thrive. So health really is the holy grail of 2020, and most specifically within COVID, we've seen a significant amount of refocus and reshift for ourselves of kind of this global pause in improving our overall health and well-being. I'm sure many of you have downloaded new health apps and really looking at how do you help support your own personal wellness and well-being. So we also know that organizations, their largest expenditures really are human capital. And within the service industry, 50% of the revenues are spent towards the population or the employees, as well as within manufacturing, 30% of the revenues are spent towards the employees. So organizations really need to help and support a greater health and wellness. One of the leaders within that and within this has been Dow Chemical Company. And Dr. Kathy Bossi has worked many years to actually create a very robust system within Dow that actually has been able to monetize a return on the investment of investing in your employees' own personal health. So every employee within Dow actually receives a health assessment upon entry, and they then also have a path to wellness and well-being and access to all of those healthy behaviors and supporting reducing the tobacco use. They have a full index that they've created. And Dr. Bossi actually provided testimonials to the US Senate in 2015 in regards to some of the findings, and hopes to really transform how organizations can further support that health. We know that the health risk factors within our ability to actually become healthy are basically socioeconomic factors. And at the conclusion of this presentation, you'll see a great video from the American Heart Association on how those risk factors are being supported with this organization. An amazing opportunity to really help to combat wellness and well-being and really enhance our overall health. And so we really want to focus on those social economic factors, but today within the work that we're doing and looking at how the environment can be a tool for health and wellness, we want to focus on that 10% that reaches the physical environment, but we know that the environment will actually improve the overall health behaviors. Within Dow, with their concerted effort since 2004, they have seen a $4.8 million less use of their health care benefits because they have a healthy workforce. And they've actually seen a 4.2% decrease in their health being at the worst health rating within their employment group, as well as when an employee retires, they maintain those healthy behaviors throughout. So the intent really here is to transform an organization to really help to get to a overall health and wellness. So what is the primary barrier of health? Stress. And work stress is one of those primary barriers. We are now living in 2020 with a significant amount of workplace stress, and many of you are struggling with working from home, and Jennifer will be talking more about how to support that environment at home. But really, what are those barriers within the stress to create a overall health outcome? Our stress levels actually are 77% higher physical stress in the US population. These are based from last year, and I know I'm positive that we are seeing increased stress levels exactly with the COVID work. And so the environment plays a significant role in our ability to reduce stress and feel calm. Once we have that barrier reduced from our psyche, we're able to actually fully engage and be present within the environment. So what we're trying to do is create an environment that actually reduces stress and promotes our ability to meet health and wellness. So how do you do that? How do you create a culture of health? Well, you need to value the role that the environment plays and value health as a primary asset. You need to make it visible. You need to be able to see it, and then you need to practice that. And so what I'm going to share with you today are really going quickly through a series of examples of how you can demonstrate value, demonstrate and make things visible for wellness, and then practice. So having shared values within an organization, we want to be able to demonstrate we are investing and we're honoring it. So making sure this is an evaluation tool that we use It's called CORE. It looks at the culture, operations, regulatory responsibility, and the environment. This is a whole person look at how the environment is supported and how the whole organization is supporting the employee to do their best work. This is an example on the right side that shows where the primary in 2011, their work environment was demonstrating some significant issues within the operations and environment. If these aren't full circles, you're not really living in your full potential. You can see that there's some environmental sound issues. So the distractions of noises, this is actually the location of this building was actually where they were dropping weights above. This was resonating through the corridors. And so recognizing that even just that simple thing of resonating of the sounds of the dropping and the banging, it's not really the sound level that's a concern, it's the distracting sound. So it's the ability to hear someone speak, or it's the ability to, or when something slams down, that's the distracting component. And so we really look to really help to isolate the environment to support those types of improved outcomes. Community, building opportunities for community. Again, in the COVID world now, this is the teaching kitchen at Dow Chemical that we put in, but there are other opportunities to create community and just the virtual community. So creating within your organization, a coffee hour. We at Enviah have a weekly coffee hour where our team just gets together and connects, right? Shares stories, because we don't have that ability now. So creating that community, as well as supporting the ability to really meet together, and maybe you do a walking networking opportunity. Again, valuing the importance of having relationships with others that support you. Access. Being able to have access to spaces that support health and healing, whether or not it's a lactation space or just a meditation or a room just to unplug, that ability to have that access within the environment. It doesn't have to be a lot, but something that you could actually promote within your space. And then visually having a restoration space. So having respite rooms or lunch rooms that have a view outside, or even just promoting out and eating out in nature, right? And so being able to recognize that the engagement with nature is really important for improved overall health and wellness. Controllability of your workplace. I talked a little bit about the sound, as well as temperature and lighting. And then next is the visibility. So you need to not only value all of these elements, but also make them visible so your folks can see that as well. And so encouraging folks to take the stairs. At Cape Coral Hospital, they actually had an artist locally paint images on the wall within their stairwell and called it Stairwellness. And they promoted, again, taking the stairs, even though it was an enclosed concrete bunker, really in creating a more inviting space for people to enjoy and take the stairs and walk. Having walking meetings, there's a lot of research that has demonstrated that walking actually promotes creativity and innovation. And so how can you take those opportunities to do an innovation session with your team while walking, even if it's a remote meeting? Mary Free-Bed Hospital, we worked with them to specifically create an environment for inspiration. And again, the goal within Mary Free-Bed was to inspire for improved outcomes. And they used words of hope and freedom to really help to promote that environment, as well as colors, to really use that environment and see the ongoing reminders of health and wellness and what the intention behind that is. Calm, creating an environment for calm is another aspect of what we can do to really help to promote an overall health and wellness. And this is an example on the left side here, where we actually were working with Children's Hospital of Orange County, where they actually converted an office or conference room such as this into a time for tea, which was a space that really was a calming time. They had electronic lights that they put in, they put calming music on, and they just had some visual nature scenes that were there that were allowing that those folks to come and just relax for that moment. It was a transformation of a conference room, not a lot of money to be able to do those transformations. And then also some cards of inspiration. And then there was a social worker in that room that would able to have a conversation if someone was struggling with something. They could talk with someone as well if they needed. And then nature. Nature is so important. We know that nature actually really quickly will reduce your overall blood pressure and your stress levels. And so having views to nature, even just screening nature within the space, or if you have artwork within your environment, having nature artwork is actually much higher proponents for improved health and wellness. And then the final stage is practice. So we want to be able to practice flexibility. We know we all have different work environments and we work best in certain areas. This intention here is to really understand that everyone works differently and honoring that and providing the flexibility to work where they need to be working best. Especially in a post-COVID world, we will have greater flexibility and need for working at home or working in the office, as well as cleaning and maintenance. So we need as well, again, in this COVID world, we need to maintain a healthy work environment, but really thinking about those chemicals that you're using as you're cleaning and the impacts that it can have with asthma and other ingestible chemicals. So really thinking through, while you want to maintain the cleanliness, thinking about the off-gassing of what that might be and really using appropriate products to support that. Fitness is very important. Cape Coral Hospital, we worked with them and they created an amazing fitness trail that wrapped around their entire system. And we actually, a part of this trail was a connection to a healing garden, which is in this location where that was part of the Calusa Elementary and Middle School. They had a teaching garden that they added as part of this exercise path. So really promoting health and wellness during their break times at Cape Coral, but then also creating a teaching garden. And as well as the final component is safety in place. So feeling that you belong, but then also making sure that the environment, you have a safe space to keep your things and that you feel safe in the workplace. That's another really important component of how you can really promote an environment to support health and wellness. So I gave you a smattering of different opportunities here, but really recognizing that the primary focus is that we need to value wellness and health. We need to make that visible with our actions, and then we need to continue to make clear practices and keeping constant with that for an overall full culture of health. And really the change begins with yourself and as leaders of organizations to be able to help to make those transitions and transformations for the appropriate support of health and wellness of that organization. This is a visual. I love this picture from North Ottawa Community Hospital when they did their emergency department transformation. They gave every one of the staff members a shirt because they were going through a culture change. How great would it be for all of us to be able to have that visual recognition on an ongoing basis to say, I can do this and I'm empowered to do and take control of my own health and wellness, and my organization supports me. So thank you so much for the time, and I'm very happy to share and look forward to Jennifer's presentation.
Hi, I'm Jennifer, and I hope today to give you a few tools and some different things to think about when creating this culture of well-being in your organization, no matter if you're at home or in the workplace or wherever it finds you. I thought that I would start by giving kind of an overview of how we approach research, and we have such a deep-seated curiosity in the culture at Steelcase. We approach all of design problems with a human-centered design approach, and that just means that we deeply listen, we test, we tinker, we iterate, and I want to encourage you guys to do this no matter where you are. We're always changing, we're always evolving, and I think it's important to always understand that as humans we are changing and evolving, and just it's okay. I give you permission to break something, test something out, and recreate it because we're all just going through different periods in time right now. I want to caution you with this graphic because it looks like at Steelcase we have well-being all figured out. We don't. We have kind of a loose graphic, but there are aspects of this that we're still kind of ironing out. We approach it with these 3 concentric circles. So cognitive being like the mental health component, and then the emotional being the feeling component, and then the physical being your body and like how able-bodied you are, or whatever impairment it is, just making sure that there's nothing standing between you and unlocking your human promise, right, to be able to do your best self. So this is evolving, like I said, and I think everybody that I've talked to, from Gensler all the way down to Cigna Health and other big clients of ours, they're all trying to figure it out, and I think that's okay right now. I think that this definition is changing, and I think it needs to be. But that's how we're thinking about it, at least right now. So whenever we're talking about in the corporate environment, these performance principles of a high-performing work environment, I think that these are all still very much in play today. And I would argue that you could apply these to your homework environment too. I'll quickly run through these because I've got some other things and other tools to help with. But this notion of privacy, I think acoustic, visual, territorial, what do you have that's owned, what do you have that's shared, and just kind of having some barriers, or whether they're transparent or not. The ability to change posture throughout the day, whether it's lounging, moving. Lorissa talked about walking meetings and just encouraging people to move about the cabin. It's no longer you come in, you sit at your desk, and that's how you're evaluated. I think all of those rules have been shattered in the last 4 to 6 months, and they will continue to be. Proximity, I think that this rule is changing too. I'm live from Alexandria, Virginia. I was supposed to be in Grand Rapids for this in person, but by God's grace, I am with you guys over telepresence, which is amazing. So I feel like you can still have relationships with people. They may be different. You might have to work harder at them for authenticity, but that's still very much something that we can have virtually. Personality is something, and being authentic. Just being able to express yourself, even if it's in a small corner of your workspace, or even if it's shared. It might be a team personality, or your organizational culture. Being productive is something else that's super important. We talk about this by way of being able to collaborate as a team and be productive, social productivity, and making sure that you're building confidence with other people and that trust. Because without trust, you can't collaborate and you can't innovate, right? And then this focus, whether it's with another person or by yourself. And the psychological comfort Lorissa had touched on, and this is so important. We need to make sure that people feel safe, whether they see cleaning materials when they come into the office, whether they see people with masks on, or whether they see views of nature and it just kind of takes them to a different place and they become calm. So I thought that I would start with one kind of quick exercise. It was done by a Japanese scientist. His last name is Nanaka, if you'd like to look him up. He's wonderful. But he talks about these things called work states. There are 5 different ones. He identified 4, and us being Steelcase, we added 1 because we thought that one was missing. But I would love to get you guys to try this out now or later, but jot these down. The first one is focus. And these are just some graphic images of what it might mean to focus, right? So as you think about your current work day, why don't you jot down the percentage of time that you think that you might be in deep focus? Whether you're alone or together with somebody, this might be production work. There's no right or wrong answer. We're gonna take these 5 and we're gonna divide your day by, all adding up to 100%. The next one is around collaboration. This can be virtual, this can be in person. This is done with somebody else. And there's so many different types of collaboration. And I would encourage you guys to think about it in terms of ideation sessions, brainstorming sessions, sharing, getting feedback, that kind of stuff. And then there's learning. Now, none of these fall into perfect buckets, and that's okay. But think about learning as what you might be doing right now. Hopefully you learned something from Lorissa. Hopefully you're learning something from me. I don't know. But what's kind of cool about learning is you're creating another wrinkle in your brain, some nugget of information that you can take back and apply. So whatever that looks like, whether it's virtual or in a book or in a magazine, jot down that percentage of time now, if you would. The next one is around socializing, and Lorissa had touched on this. And this is super important for building trust in your organization or just with relationships with your neighbors, right? This can look like coffee or a walking meeting or lots of different things. So jot that down. I warned you that we added one around rejuvenate. These are those spaces where you just go to take a minute. This could be a lactation room. It could be a nap room. It could be an outdoor space. It could be so many different things. We're seeing prayer and meditation spaces. We're seeing neighborhood cafes, just lots of different typologies. These are just a few examples. But as you look over those numbers, hopefully they add up to 100%. I know we all give 110%, but now what might be interesting for you to do later is to go back and think about 6 months ago and look at how those have changed. And think about your workspace and how that might need to change with it. So please steal that tool. I think I stole it from somebody. Well, obviously I stole it from somebody. So just use it. It's great with clients or with peers, just to kind of think about space a little bit differently. So we are all, well, at one time, I think you guys are still working from home too. We all have different situations. Some of them are good and bad and ugly. We did a tremendous amount of research on this. I guess I think it's been 2 months ago now. And these are some of the pictures that we gleaned from our research. And some of these are ugly. They're working, right? This one, the last image, is probably my most painful. And this looks like it's on the edge of a bed with a hard chair. And it's just power cords are everywhere, even over here on the sofa. It looks like there might be a couple people working in one environment. And these were never intended, I dare say, for somebody to sit for 4 to 6 months of one's life 100% of the time, right? And that's how we're using them. So that's why I said at the beginning, I give you permission to make changes, break it, ideate, and kind of evolve these situations to make them a little bit better. I'll show you some that we've kind of put together, and these are renderings, they're not pictures. These are just some ideas that kind of play off of territorial boundaries, some visual privacy, but also a little bit of ergonomics. And I do have some, I don't know, work from home tips and tricks that our ergonomist put together for me. He's amazing. His name is Kevin Butler. You can go on YouTube and Google his name, and he'll give you the shortest possible tips and tricks video on just taking a folded up sweatshirt and how to position that, as well as some cushions, and make a wooden chair just a little bit more comfortable. But I would encourage you guys to just be curious about what you can do with stuff that you might have at home. And these are just some examples of what we're suggesting to others. This is called an active rise. I know there are other brands that are out there. I am part of our sales team, but I'm a designer, so I'm not really a salesperson. But there are other brands out there that do a similar thing, but it basically raises up your work surface so that you can stand and move and sit, which is kind of nice. Having that lighting control is always nice. Not having to hunt for power. You'll see this clamp on power right here. I can't tell you how many times I have to like crawl underneath my desk to plug something in or unplug it, or or it's, I don't know, falls out of the plug or something miraculous never ceases to amaze me. So again, these are just some examples. These footprints are small. This one's in a bedroom. So if you're in a small city apartment, you know, there are ways of making it work and kind of blend in to your bedroom, right? So those are just a few examples of what I think might be able to help you, because things are changing so rapidly. So thank you guys.
Wonderful. Dr. MacAllister, we've got a lot of companies that have very limited space and even more limited budgets. So what are some of the first steps that a company can undertake to improve their workspaces or their workplace environment?
So the first place that I would start is really identifying what that organization and what your organization as a culture values as health and wellness. And so really working with your entire team to understand what is really important and what helps somebody feel better about their day and moving about that. So really identifying those clear, really quantifiable outcomes that will help them measure their success. So really beginning with the end in mind. And then once that's understood, you can shift the environment, as I gave some examples within that, really looking at the environment as a tool. And even if you split with part remote and part in person, or what that might be looking like, really making that value and understanding that value as a really important part, and bringing it back to the saying, okay guys, we're gonna put these things in the environment. Maybe you reconfigured part of your space now to say, we're gonna make a meditation room and maybe an old office that allows for people to come in safely and really just decompress, and then coming back to that. So bringing that awareness would be the primary component of within the organization, naming it, identifying it, and then helping everybody feel empowered, as Jennifer was saying, giving yourself permission to make those changes and try it out. And again, trying to break bad behaviors potentially, and encouraging each other, being support system for each other to stop smoking or taking a walk in the morning, or what those things, and start a new routine.
So as a follow-up to that, I know you've worked with a lot of different companies. How did you work with them to engage their entire teams with this change management? And what were some of the best examples of how they engaged the team and the people to become empowered? I think that's an easy word to say, but I think it's sometimes harder to do. So how do you guys do that?
Yeah, so a lot, again, we really work with what are the key drivers of that organization? What are their, what are their primary drivers? And a lot, as I mentioned, a lot of the service-based organizations, it's really getting people to be the most productive. And Jennifer mentioned productivity is key. And even in hospitals, you want the physicians to be the most productive. You want the clinicians to be most productive, but then you also want those engagements with those behavioral relationships. So it's really having the leadership of the organization set a clear understanding and parameters. And then once that's understood, what brings the buy-in is the clarity of those objectives and measures, but then what brings the buy-in is making it visual. So making those visual changes and making that become a practice within the organization. So for example, with Cape Coral Hospital, they wanted to promote healthy food intake, right? And so one of the components, they had a cafeteria in the hospital, they pulled all of their fryers, right? And that was huge for the organization. They got a lot of pushback, but it actually allowed for them to recognize, no, this is serious. We really want you to have those options. And then the CEO would go around and pass out Lara bars or other like health bars, right? To be able to support, again, a healthy behavior, healthy lifestyle. So having healthy snacks available, creating, just having fruits and vegetables available as a snack as opposed to something different. So something as basic as food is a great place to start, and creating those environments to support. So as an architect, you still want those environments, thinking about how do you make that in a space? Well, make a designated space for that to be in place, right? And really make those changes visible so everyone can buy in.
Yeah. So what do you think are some of the elements that are often overlooked when someone's assessing their environment and how to make changes, and yet they're very critical and they get missed? What are some of those?
So I would say that visual clutter can be very stressful for many people. And so those, I would say, is something that initially gets overlooked because you see it every day, right? And so you don't recognize coming to it with fresh eyes and recognizing what are you seeing when you walk into the space, and coming into it as a client might enter, or we actually do something that's called through the patient's eyes, where we walk the entire path and as you were a patient, and really understanding what's occurring and how the environment could actually increase your overall stress and agitation, just because it's not visually organized and clutter is, there's things everywhere. Even just taking down a lot of signage, what we find a lot of times is there's oversigned spaces because you want to tell people where to go. Signage is in a way a failure of the architecture because you're having to direct people. So we really, I would say, taking a fresh step into how you're coming into your facility, what it looks like. An example of a really low cost solution outside of just taking down things. What Cape Coral did is they realized that the staff members were walking through this cavernous space, and they had the same artist that painted the wellness. They actually had the artist come in and paint on these brick walls beautiful mural of koi fish in a pond, right? And so now you're walking by this beautiful space every morning and really makes you inspired to go to work. And so thinking of something that you're like, well, I couldn't do anything with that. No, think about, the kind of the entry and what you're seeing every day.
Thank you.
Mm-hmm.
Jennifer, when you're working with companies to make changes to their workspaces and drive that culture of health, how are you incorporating some of the education and the awareness and why you're doing what you're doing with these workspace changes or the environmental changes?
So Lorissa made a great point. Any change starts with great leadership and articulating a vision. And if you don't have that, no change is going to be adopted, no matter how amazing it is. You can't build it and they will come. It's half the time it won't even be used, or maybe even more than half. I don't know the specific number, but I know that it won't get used as much as it would be. It wouldn't be as successful. But I was ProSite certified maybe a year and a half ago. And that was such a fascinating class because all change, and Lorissa mentioned this, and what was it? Change begins with me on the t-shirts, right? Change is individual. You can't change an organization. It starts with each individual, and there are barrier points to making a change. Stress is a huge barrier point to health. And so, right, so if we look at the barrier points to change, it's actually a very linear process. And at any point you have a barrier to any of these, a change won't be adopted. And those barrier points are super simple. And I'll give an example. So awareness, or just having an awareness for a need. So that's supporting and participating in the change. Like, you want everybody to be wanting to participate. Change can be exciting. It can be scary too. Well, it can be really scary, but knowledge. So do they have the skills of how to change? Do they know about the behaviors? They have the ability to apply what they learned. So this is just learnings, right? Can they actually execute it? And then reinforcement. So this is sustaining change. So that could be celebrations or positive reinforcement, attaboys, that kind of stuff, or monetary, maybe, I don't know. So if you think about those, I did a lot of research on mothers' rooms, and I continue to kind of evolve that, and lactation spaces, I should say, because that's more gender neutral. But what's interesting about that is I worked with a company a few years ago, and this was before taking my change management class. And they wanted to put one in. They had an awareness that they had a couple people that had a deep desire to have this. They had a need. So they had the awareness and the desire. But after it was installed, nobody knew that it was there and what purpose it was supposed to be used for. So the purpose and the intent was lost. And so that room was being jockeyed for by not only people that needed to go in and pump, but executives that wanted a place to take a nap, right? And so the knowledge and the behavior was just completely lost. And they thought it was a great napping space, right? So that's a really great example. So start with awareness and then go to desire and then go to knowledge. Everybody's going to change at a different pace, but making sure that you have opportunities in each bucket. And finally, just that reinforcement of whatever it is, celebrate. So.
That's wonderful. So if you were to recommend some simple, affordable changes that companies could do to improve the work environment. Again, we work with bigger companies and smaller companies, but budget constraints are always a big concern. From simple and affordable changes, where would you advise they start?
So I've got two recommendations, and I'll preface the first one by saying this one is free. Right? So that's always right? David Rock, who wrote the book, Your Brain at Work, he's a neuroscientist, and I'm not going to pretend that I read the whole thing because I'm a designer, and that whole book scared the living daylights out of me. I read maybe a quarter of it, and then I skimmed the rest of it, but it's fantastic. He had a really profound statement in there that really hit me, and he said something to the effect of, you can have the same outcome of a positive impact by offering choice and perception of choice. So just by involving people and having a voice and not necessarily a vote, you're giving them the same opportunity as offering them a choice. Even if they didn't really have one, there's the perception of, so it's still the same outcome, which is pretty profound. So if you can encourage people to participate in the work culture and just within the organization and be curious. I think that's something for free that you can do, and people have more ownership over the space, right? To try out things, to work in different places, to try out different schedules, to try walking meetings, to try some of these things, because not only were they their own ideas, they had this perception of choice. Like I can meet here, or I can go outside and go on a walking meeting, right? So that's free. Being at Steelcase, we love our 4-box matrices and we love organization. And so I'll take what she said one step further, just because I love exercises and things. But if you have on the y-axis impact level, so you have all of these different ideas and maybe suggestions from people and what you want to do, you can chart them on an impact level, right? Like we want to add a cafe space, we want to add a walking trail, we want to have like all these different things, right? So you can chart them on that. And then you can, on the x-axis, you can chart out the effort that it would take, whether it be time, money, whatever it is, length of time to implement. So that walking trail, you might have a team of people that are super passionate, throw in the labor for free, and that's actually a high impact because it aligns with your cultural values within the. So that actually might be a high impact, low dollar amount, and so I would say that would be ideal over a cafe, because that would it might include some more intense things. So yeah, those are my suggestions.
Wonderful. I'd like to just segue just a little bit and ask you, over at your organization and in your role right now, what kind of changes are you seeing now with COVID-19?
That's a really good question. At the very beginning of the pandemic, and it's kind of weird, when this all broke out, I was actually in Vietnam, and they closed the border 2 days after we left to come home. And so we were actually on lockdown in Asia with family, and that was mind blowing. So we saw our friends working from home a month and a half before, or maybe a month before we got the orders to stay at home. So watching what happened over there and then here, it was a little bit different. At the very beginning, Steelcase was getting an incredible amount of requests for screens, for recommendations for 6-foot social distancing, and for what do we do with these conference rooms that have one screen and now we need like 4 screens to support virtual, and then also traveling patterns within the office, right? Like they all need to be one way now. But that's really changed over the last month or so. And so we're looking at more flexibility, not just in the environment for preferences, but we're looking at policies that are changing for flex time hours, work from home permanently, which is just mind blowing. We're also looking at jobs and roles changing. So people actually taking, for example, our showroom experience manager, she's kind of moonlighting as a designer with me right now. So because we don't have as many people in the showroom, so she's hopped over. She's helping me out because she came from interior architects where I came from. So we have a very, very similar methodology of design. And so she's helping me. Materiality, there's so much more concern over cleanability, no touch surfaces, non-porous surfaces, that kind of stuff. How we host people has changed tremendously. The transparency of our policies, access to cleaning products, and then the group sizes and virtual technology components, that has just, I mean, I think that it'll be changed forever.
Yes, we're also seeing, because of the amount of remote work, the really opening up of real estate and space that organizations are having, and repurposing and retooling that space for something new. Maybe it's a new business model, or maybe that they're deciding to shed that type of space. They don't need it anymore, or shifting it to, again, we work mostly with hospitals and healthcare organizations. So shifting maybe some of the office space that they have into new patient treatment areas. And then the final aspect is really, again, working with a lot of healthcare organizations, getting people to trust to come back to the hospital and feeling comfortable coming back into a healthcare organization, and recognizing that a lot of it is just that visually seeing the safety that's in place for their own care, whether or not it's the demarcations on the ground, or the clear understanding of the PPEs being worn, and the hand sanitizer, all of those elements. And so how do you create an environment of safety, and looking at, whether or not you implement changing of the doors, and all of that. So all of that kind of wraps up into really what we're seeing a lot of requests are new strategic planning needs. So it's really retooling what they had in the strategic plan. A lot of organizations are coming back and saying, okay, things have changed. We really need to recalibrate how we're going to be looking out just for the next 2 to 3 years, and really helping them retool their whole vision into the future and how they can bring that together.
Yeah, that's very interesting. And it's interesting too, because even from the AHA side, much to your point about perceptions of safety and sanitation, the American Heart Association has a campaign called Don't Die of Doubt, where we're trying to encourage the public. If you're seeing warning signs and symptoms, for crying out loud, call 911 and get to the emergency rooms, because there's been a significant drop-off of people who are going in to seek medical attention when they're showing symptoms of things. And your outcomes are really based on time. Time is brain, time is your heart's ability to recover and for you to resume as normal as possible a healthy life. So we're pushing that dialogue as well, because there is fear out there in today's world. Mm-hmm. So I had one other question I was going to throw out there, just because in looking at your presentations, the concept around relaxation or rejuvenation spaces, what % of businesses that you're working with now are actually using those relaxation or rejuvenation spaces?
I would say that for our organization, when we put them in, again, it's going through, do you value that? You make it visible, and then the practice of it. And I do believe that the organization, while they may make it visible and they may say that they value it, it doesn't get used in the way that it was probably designed most efficiently, unless leadership really supports and allows and gives permission to do that. And so unfortunately, I still think that we're in the world, and maybe this reset of our COVID reset would allow, and my hope would be, is that we have different metrics that are focused on the importance of wellness and well-being, because so much of our outcome measures, especially in hospitals, is doing no harm still, right? We're looking at making less errors, we're improving our productivity personally as a clinician, and so it really doesn't allow for that permission to actually assess if I'm doing okay as a staff member or as a caregiver, right? And so bringing to that level of an understanding and saying, no, we need to put some measures in place to be able to really assess that my team is supported and has what they need to really work at the top of their license and really work at their peak. And so without that recognition within the organization, I think that even the best intention of designing of these spaces won't be sustained. And so unfortunately, I would say that majority of the organizations that we put these into don't get used. I think the ones that actually create their own. So one of our hospitals, they actually created their bathroom and they renovated one of the staff baths into a respite space because that's all they had. It gets more use out of that space than anyone else because it was really birthed out of the grassroots of, we just need a place to just escape for a minute, and that's okay. But I think that, again, it needs to be supported.
That's great. And Jennifer, I'll ask you the same thing.
Yeah, I think for me, it depends on the part of the world that we're talking about. I know it also depends on the vertical market too. So with energy companies or law firms, or like there's going to be different kind of microcosms of culture within. So as a swath of just taking Mid-Atlantic, which is Pennsylvania, Delaware, Maryland, Virginia, and the District of Columbia, it's kind of interesting because I see a range, something like 5 to maybe 15, maybe 20% of space, which is allocated for kind of a rejuvenation or a refresh, and I would throw nourishment in there as well, like neighborhood cafes, not necessarily like the big cafe, like the corporate cafe, but I'm talking about like a neighborhood cafe. Now that kind of crosses the line with social, but I said that all the buckets, they're not perfect, right? But it is more about the usage of the space, like Lorissa was saying. So I find that the most successful spaces are the ones where there's a deep awareness and a deep desire to have them, and it's actually driven by the employees to have these environments, and they've had a say in what they are. And I'll give an example. There's a big engineering firm up in New England that has a huge population of Muslim workers that need to pray throughout the day. And so they have these prayer rooms that are in strategic locations, and they are used all the time, right? But it's for a very specific need, and it's driven by the employee population. Same with lactation spaces. There's an employee base that really fights and uses the spaces on a regular basis. So those are just 2 examples.
Wonderful. Well, I'd like to thank you both so much for joining us today and sharing some of your expertise on this topic. Dr. Lorissa MacAllister from Enviah and Jennifer Kirby from Steelcase, thank you so much for joining us today. It's really such an important topic around considering the overall work environment and how it plays into the impact of health in an organization. I'd like to thank our generous sponsors, Meyer, Weist Electric, Priority Health, and Terry Berry for making the West Michigan Wellness Symposium series possible. Because of generous donor and company support, the American Heart Association can really continue this critical work to close the gaps and disparities of health. And so this West Michigan Wellness Symposium was really created as a forum to learn new information, share ideas, and come together with this vision of helping West Michigan become one of the healthiest places to live, work, play, and pray. We're glad that you took the time to join us today. And if you'd like to find out more information or get involved, you can reach out to our office at 616-482-1503 or email me at jean.lesargebono@heart.org. Take care, everyone, and stay healthy. Thanks again.
Hi, I'm Tony Sprolbaum, the Vice President of Wellness at Health Plan Advocate and the proud 2020 chair for the upcoming Grand Rapids Heart Walk. I've been a passionate volunteer for this Wellness Symposium Committee for the past 3 years because I just love the AHA's mission to build healthier lives for all. One of the founding values of the American Heart Association has been health equity, and because of your support, they're working to close the gap in the disparities of health. Coming up, I'd like for you to watch a video about the impact of the AHA's work in West Michigan. I'd also love to invite each and every one of you to support this work by participating in either the Grand Rapids or Kalamazoo virtual Heart Walk, coming your way during the month of September. We're going to practice healthy habits all month long and then celebrate the virtual Heart Walk event on Friday, September 25th. You can register online at grandrapidsheartwalk.org or kalamazooheartwalk.org and get heart walking to build healthier lives.